Very good.
Thank you. So Liliane, what propelled you to create the Leading from Humanity event?
It was really about, it's a calling forth in a public way. It's calling forth humanity. What is humanity? What does it really mean? What are we looking for as individuals to receive, but also how do we give it? And really it's about what our intentions are, bringing our intentions to a higher awareness, and being very, very aware of the impact. Because we can have great intentions, but the impact that we're creating is not what we were looking to create. So it's learning more about ourselves in relationship with self and with others. And that is, to me, the relationship-centered care, which is what I talk about, is in service of patient-centered care excellence. So that's the true humanity piece in healthcare.
Excellent. And what are you hoping delegates are going to get out of the day?
Well, I want them to walk out with pieces from each person's stories and the speakers that are bringing their experiences to life, that there's something there that we can relate to. And also, at the end, we're going to create something where people will start to take on the ownership of that. Because a conference can be just a long lunch and learn. It can be something where people get really piped up and excited about things, and then they walk back into their life doing the same thing. Sure. So we want to make sure in this conference that we're not talking to people, but we're talking with people, so that they can in turn feel like they have something that they want to change moving forward. And so we're going to make sure that that happens by the end of the conference.
Well, that's great, because actually that was leading me to my next question, was how can this event, this one event, affect change in behavior? Are there other events being planned in the future? Is this going to be an annual conference, for example?
Yes. Yeah, it will be an annual conference. I'm not sure if it's going to be the same theme, if it's going to evolve from that. I'm trusting that the audience and the people who participate post-conference will help me see what the need is, etc. But we're looking really at creating a different culture, a culture of leadership that comes from the place of humanity, not just leadership, because we believe that leadership is about people following a leader and depending on the leader to make the changes. Whereas leading from humanity means that everybody is responsible, not just responsible, but takes ownership of creating that humanity. And that's what we're calling forth, is really the individuals to take ownership for themselves and for their world. That's what true leadership is. It's not about just leading people and doing our job. Then we've missed the point.
Exactly. And I think this culture shift that you're talking about is something that anyone can do. So even if you're not in a leadership position, you're the unit nurse. How are you going to behave differently now that you understand, from a patient perspective, what are the ramifications? And so I think that that culture shift is very important.
Yeah, and the key to that, I love that where you're going with that, is because the key to that is not about creating leaders in healthcare only.
Correct.
It's about creating a leader for self, so that I can create my desires, ask for my boundaries, ask for what I need, offer what I can, and it's going to be who I become in my life.
Right.
So it's 24/7. The last thing we want to do is create people to clock in to be a certain person.
Sure.
We want them to develop their life in a certain way so that they honor themselves, honor other people, and in turn, we change the world all together.
Wow, that sounds wonderful. I really can't wait for this conference to begin.
I'm looking forward to it. Can't wait to see everybody meet new people and get new ideas. Right? We're all in it together.
Wonderful. Thank you so much.
Thank you.